My name is Bob Ndube. I am part of the Linda Initiative that consists of 3 local companies that have come together to respond to the challenge that we find ourselves in as a nation and as citizens of the globe. First and foremost, I need to give you a little background that part of the reason why the 3 organizations came together was to try and find out how can we use technology to intervene in what is going on, to just be part of the solution. And we said, look, one of the biggest challenges we are facing as a nation is how do we track who is COVID positive, who is in a danger zone, who is in a likely position to be exposed. That was our first challenge, and we put our technology heads together, and we said, look, if we can get something that can notify people within a certain distance that there is a possible COVID-19 positive person around here, then people will be more alert. But it does more than that, because among other things you're looking at, okay, fine, at the moment the country is talking about 1,900 people who've already been tested and released, and these people are left to their own conscience because they're supposed to self-quarantine. But as we speak, we do not have a mechanism for monitoring these people. So that's the kind of thing that Linda app addresses. But more importantly, we have appealed from the government that people need to stay home. That's one of the best ways of ensuring that we are not passing on this virus. But we also realize that majority of Kenyans are young people, and staying at home, these are restless people. Staying at home becomes quite a challenge. So how do we incentivize them to make sure they stay at home? And that's one of the things we've done with the Linda app, because what we've done is that we've incorporated gamification. There are challenges that are built around things like how long you can stay at home, how well you can wash your hands, and there are rewards at the end of it. For example, for young people, we have data bundles to make sure that there's a reason why this young person stays at home, so that they can do their reading on the internet if they want. The ones who want to go to social media, WhatsApp, Instagram, TikTok, so on and so forth. But the other thing that this is addressing, because we've kept asking, how do we help people to stay at home, and some people live on hand to mouth. So one of the things you're doing is that if you can successfully complete some of these challenges, some of these tasks, one of the rewards you're giving is a shopping voucher, so that you do not have to worry about staying at home, yes, but how do I feed my family? So we are ensuring that yes, you're staying at home, you're keeping yourself and your family safe, you're keeping your neighbors safe, you're keeping your fellow Kenyans safe. But in that staying at home, we are also reaching out to you and saying, look, thank you for staying at home. Here's a gift, here's a shopping voucher. And we are talking to as many partners as possible, from supermarkets to different shops, to beauty shops, to food companies, to make sure that our people are well taken care of. The key driver, the front line, the generals and the soldiers are actually the Ministry of Health. What we are doing is we are giving a helping hand. What you're doing is that we're giving a solution. We are saying, look, here's our contribution, and this makes it easier for you to track. It makes it easier for people to self-report. And yes, we expect that we will be working very closely with the ministry, because this data really has to be of use to the ministry. We've talked about geofencing. That is for people who need to be fenced to certain areas. But what about you are negative, you want to go about your business and stay safe? So one of the things we've tried to do with this app is to help show that the areas where the concentration is higher, the epicenter, some are already out in the media, some are not. Part of the government response has been to sort of quarantine certain areas. We have a blockage for Nairobi, for example. You cannot get out, you cannot get in. We have a blockage for Mombasa, Kwale, and Kilifi. But the point is, even within those areas, the level of concentration is not the same. So what happens to people within Nairobi? How do they know where they need to move, how to be safe? And that is what part of the solution that we try to offer through this app. In terms of usability, we've made the app very simple so that anybody can use it. It's basically you have the app, you're within certain distances, it warns you, you want to stay, we challenge you to wash your hands, and we challenge you to stay at home, and you get rewarded for it. So in terms of who should use this, it's everybody, each one of us, because at a time like this, we each have a responsibility, first and foremost, to protect ourselves, to protect our loved ones, and to protect our neighbors and everybody we come into contact with. So this is a mass product for each one of us. So, and the reason why we've chosen to use the phone is, the mobile penetration in this country is very, very high. And yes, we appreciate that some people might not have smartphones, but we have to start somewhere. So this is a start, and from our data, I think the smartphones in this country are very widespread, and the studies show that part of it is that's how majority of Kenyans access social media, and for that reason, I do not think we have fear in terms of who we are reaching. The smaller population that might not have that at the moment, I cannot say we have a solution at the moment, but our technical team is looking at it.
The app is made of two components. One is the component where you have to go out, and second is the component that we have challenges. So in the component where we have challenges, we have put several challenges and points where you can redeem. So for instance, social distance challenge, you're supposed to keep 1 to 3 meter distance for 3 hours. So what you do, you go to the app, and under the social distance challenge, you start a new session, and it immediately starts a countdown. Now, once you start the countdown, you cannot interfere with that setting again. So for those 4 hours that you're starting the challenge, you cannot leave. Now, when you are satisfied and the 4 hours are over, you earn 4 points. The other challenge is the daily reporting challenge. Now for this challenge, it's basically how are you feeling right now. Now the daily reporting challenge, you will take it 2 times in a day. Take it in the morning at 9 a.m. and at 6 p.m. in the evening when you get home. Now this is where you say how you're feeling. You could either say you're feeling normal or you're not feeling well. Now the next challenge is a stay at home challenge. Now for this challenge, you're supposed to stay home from 6 a.m. to 6 p.m. without getting out of your home. Now we have zoned the radius of your home area, how the radius, how it should be. Now you go to the app, you reserve a spot. The app will take the spot where you are, and it will create a radius, and you confirm that you will be in that spot for the next 8 hours. Now once you're able to get through this, you rewarded 12 points. Now there is also wash your hands challenge, which is coming soon on this app. When you wash your hands, you take a photo using the phone with the application, and it gives you points. The app can actually detect whether your hands are wet, so that also encourages social distancing. Now when you want to redeem points, you go to redeem points, the points where you've accumulated. In this instance, you can redeem either bundles. We are also in talks with different entities, including supermarkets. So when you redeem any point you get, you're able to redeem, and then the phone will ask you to verify your phone number so that you're able to redeem your particular points. Now the other component of the application is when you want to go outside and you want to stay safe. So what the app does is that it picks your current location, where you are, and within 100 meters radius, it tells you whether there is a suspected case or it tells you whether there is a confirmed case, but it will not show you exactly who the suspected case is. So within the 100 meter radius, it will actually tell you, it will show you a color. For instance, green will show you that there is no risk in that particular area, but it will still prompt you to wear your mask, and it will still prompt you to keep washing your hands and sanitizing. if there is a suspected case, the color will turn to orange. So that means that you have to maintain social distance, and this is actually very important for public service vehicles and also in crowded areas. So you'll be able to know you're in an area where there are suspected cases, but the cases are actually not confirmed. Now, in this instance, if you breach the social distance, your phone vibrates. So if you get close to a person and you breach the 1 meter distance, your phone vibrates to alert you that you're actually breaching the distance. The other component of the app is symptoms. These ones are derived from World Health Organization. So you check the symptoms that are synonymous with COVID-19, and you can actually take a trial virtual test. Now, the reason why this one is not enabled right now is because for you to take a trial virtual test it's not a medical application. So once you take a trial virtual test, this data will be generated on the background, and it will give you a percentage based on the symptoms you're feeling. And then that data, if it is more than 90%, will be sent to a ministry official who can assess whether who will give you a call to ascertain whether it is true you could be having COVID-19 or not. Now, there has been a lot of misinformation about COVID-19. So if you want to fact check any information, you go to the information beacon, and from there you can be able to get frequently asked questions about COVID-19, and you can actually cross-check against the application. So in case you feel that you might be having symptoms and you might be infected, you click I might be infected help, and the number takes you directly to the Ministry of Health number, and you can call for assistance.
COVID is real, and deaths are happening. Families are hurting. Now, this is part of our solution. In fact, we consider it our Easter gift to ourselves and to the nation. So let's get hold of this app. Let's download it. Let's use it. Let's utilize it. Let's keep distance. Let's stay at home and get rewarded while you're at it.
This Linda application will be available in the course of this week, most likely by the end of this starting week.
Mobile Journalism Africa. Our stories are best told by us.